Minister Plevris, distinguished guests, ladies and gentlemen, thank you for the invitation to be here today at this important summit. As we're meeting here this morning, we continue to see millions of people fleeing from the illegal, senseless invasion of Ukraine. Many of these refugees are patients, vulnerable populations, women and children. Many are cancer patients, both adults and children. From the first day, European solidarity has shone through at all levels. Together with all health ministers, and I would like to take this opportunity to thank Minister Plevris for all his support. We have secured the first 10,000 beds to transfer patients in need of medical care. These include beds for both adult and pediatric cancer patients. We are in contact with NGOs on the ground to see what help they need. We speak with pharmaceutical companies to see the difficulties in supplies. And we will do everything possible to ensure coordination at European level to help those in need. COVID has shown us that together we are stronger. At the same time, we continue to mobilize all our efforts to address the impact of COVID-19 on cancer. The pandemic, we should not forget, is still with us. But our European solidarity and working together has shown us that we can deal with unprecedented challenges effectively. And the fact that we are all meeting here today is proof of this. The past 2 days have added a new layer of challenges for patients and for healthcare professionals. At the same time, the pandemic's impact on cancer prevention and treatment has been severe and continues to be so. It has disrupted and delayed screenings and treatments and reduced access to medicines and follow-up care. It is today estimated that over 1 million cases of cancer remain untreated and undetected in Europe today. It has highlighted the tendency to underfinance and underprioritize our health systems. And it has clearly demonstrated the crucial importance of contingency planning to have the continuity of cancer care in future crises. These and the more immediate challenges and that we need to address when we look at continuing tackling cancer today. And I say and use the term continuing tackling cancer because throughout the pandemic, we have not taken our focus off cancer for 1 minute. And how could we? When 1.2 million people each year in the European Union lose their lives to this disease. Here in Greece, recent cancer statistics say that it accounts for almost 1/4 of all deaths. These are sobering numbers, and each of these numbers reflects a personal story. These are not just statistics. At the height of this pandemic, we launched Europe's Beating Cancer Plan. This is the first EU-wide plan ever. With this plan, we laid down the beacons that will guide our policy and our actions in the years to come. And 1 year later, we have put building blocks in place. Firstly, and perhaps I would say most importantly, inclusivity. Our cooperation includes all stakeholders and all policy areas. Thanks to this, we can take a comprehensive, joined-up approach to the challenges posed by cancer. the whole of government, and across society in practice. Secondly, we are addressing every stage of the cancer patient's journey. That's why the pillars of our plan cover the entire disease pathway with ambitious flagship initiatives and actions. Thirdly, running through the entire plan, we have our cross-cutting themes of research, innovation, digitalization, personalized medicine, and crucially, access and reduction of inequalities. Fourthly, we need to deliver. So we have a public implementation roadmap which keeps us on track with a timeline and milestones, and which today shows how much we have achieved in a year. And last, but by no means least, we have substantial financial support for the first time of 4 billion euro to deliver what we have promised. Last year, we put almost 80 million euro into launching 16 major initiatives with the support of the EU for Health program. This year, we will maintain this momentum, focusing on prevention and diagnosis with over 100 million euro to address key health determinants, health promotion, and primary cancer prevention, knowing that 40% of all cancers are indeed preventable. In February, to mark World Cancer Day, we launched 4 major new actions: the joint action on HPV vaccination, a call for evidence for the proposed revision of the Council recommendation on cancer screening, the launch of an EU network for youth cancer survivors, and the first phase of the Cancer Inequalities Registry. It is important to note that this will facilitate the high standard and quality assured diagnosis and treatment. Ladies and gentlemen, ensuring equal and fair access to preventative measures, early diagnosis and treatment, and personalized care is perhaps, I would say, the cancer plan's main goal. We want to address the significant differences that exist between and within member states and between different socioeconomic groups. To that end, the Cancer Inequalities Register will provide a wide range of data to better guide treatments and actions. In parallel, using the latest scientific evidence, we will update the European Code Against Cancer. It is important for us to provide people with simple messages on how they can reduce their cancer risk, and to revise the Council recommendations on screening. Together with the mission on cancer, we will continue in order to use data, digitalization, and new technologies. Innovation is key. Last June, we set up the Knowledge Center on Cancer to coordinate and align scientific and technical issues related to cancer care and treatment. And in a few weeks, I will be presenting the European Health Data Space, a key tool to harness and the power of health data for the benefit of cancer patients. What this will mean is that it will make it much easier for cancer patients to access and control their health data, as well as to share this with healthcare providers of their choice. This can really help a lot of cancer patients who will need to be consulting different specialists, possibly in other EU countries, and it will facilitate research and innovation. Furthermore, we will set up the European Cancer Imaging Initiative to develop an EU atlas of cancer-related images, making anonymized images accessible to all stakeholders. And by 2025, in order to offer high quality care for all, we are going to be creating an EU network of comprehensive cancer centers. This will help member states set up new reference networks in the more common cancers, but importantly, they will link existing networks relevant to the rare cancers. Ladies and gentlemen, it is important that we have this across member states, this cross-country cooperation, because this will facilitate the uptake of high standard quality treatment and diagnosis. And we all know that in order to provide high quality cancer care, we need to be able to have specialists, trained specialists. So we are launching an interspeciality cancer training program to improve the access of care and treatment for cancer patients and those who have lived through cancer. Ladies and gentlemen, it has been mentioned, but I will say it every time I get the opportunity. Delivering on the cancer plan, for many of us, is personal. It requires a team effort. And this is a commitment that brings us all together. It brings together the Council, the Commission, and the European Parliament. But your full commitment and strong cooperation are vitally important. Today, I am here because I'm reaching out to each and every one of you, oncology experts, patient advocates, researchers, health professionals, and policymakers. Because together, we can make sure that every single patient in the European Union has the full range of high-quality care and treatment they deserve. Ladies and gentlemen, this is Europe's plan, and together we can make a difference. Thank you.